I think Dr. Fauci, head of the NIH part on respiratory illnesses, has said that some of what they're seeing in the data is that it will have surges. It will come back. It's until we have a vaccine, until we have immunity in our population, it's going to be a threat for us. And this is really going to be something we're dealing with over a couple years. But again, the more time we buy, the more we take these precautions now. We don't want to have a second surge now in June. And then the best science will guide us as we enter fall, what kind of precautions we need then. And every day they're fighting to get a vaccine. Every day they're testing to have an antiviral, which I think we could have sooner than we have a vaccine. You see that there are antibodies, serum from people, actual antibodies from people who have already fought off the disease. That's being looked at as a form of treatment. All those things could come in play, hopefully, before we get to having to deal with that in the fall.
Let me just make sure I understand something you just said. We could be dealing with this for 2 years?
You know, this virus isn't going to go away. It's going to spread. You can see in countries in Asia now, they're worried about it being reintroduced. Not their entire population was sick with this disease, and therefore there's still lots of folks who are able to catch it. And until we have a vaccine and actual population level immunity, those of us who haven't become sick in this first peak are still vulnerable. And that's why a vaccine is so very important.